Health authorities are increasingly frantic to entice doctors to work on their days off as a fresh wave of emergency department closures becomes more likely. Now, those ER closures have hit rural and remote communities hard, but lower mainland hospitals could soon be on diversion overnight. Our Penny Dothos has been working on this story. Penny, we've seen incentives for physicians to pick up shifts before.
Yeah, and if you saw offers of thousands of dollars to work those unfilled shifts, but that's still not enough. And health authorities are now pressuring doctors to take on more work in order to avoid even more emergency department closures. It's been working so far, but there is a cost.
British Columbians in the north are no strangers to locked doors at the ER, but they're reaching a breaking point.
It's a combination of frustration and fear. People are scared. We especially now the temperatures are pretty warm.
Fort St. John's Hospital shut down overnight for the 5th day in a row, while Fort Nelson doesn't know when their ER will shut down on short notice.
They're experiencing daytime closures, overnight closures. The entire province, especially in rural BC, are experiencing these diversions over and over and over again.
A desperate memo to Island Health doctors offered $3,200 to work at the Port Alberni Hospital, plus a room at the Sprout Lake Resort, along with a guilt trip. If the shift is left unfilled, all ER patients will be diverted to Nanaimo. Someone stepped up this time, but Island Health has major gaps in the summer schedule, and in Fraser Health, Mission Memorial and Peace Arch hospitals are on the bubble. Entire days are unstaffed despite up to $4,000 a shift up for grabs.
It's really hard to provide the service that we usually provide, and it makes us inefficient. And hence the waits increase, the frustration level increases.
Multiple sources tell CTV News the Wait Times website dramatically underestimates the times in lower mainland hospitals. This comes as a new contract for family doctors has lured many emergency physicians to 9-to-5 jobs, and the throttling of medical school seats for decades has shrunk the workforce long term. Despite the challenges, no one wants to provide substandard care.
Our number one concern is how can we make things better for patients that are sitting in our emergency departments. And a lot of that comes down to, again, making things better for those that are showing up to work.
The reality is becoming clear. Our healthcare system has relied on our medical personnel working tremendous amounts of overtime to prop it up. Fewer and fewer of them are willing to do that, and pressuring them doesn't help with morale.
The health minister was not available for an interview today, but in an email says they're using multiple strategies to recruit staff and avoid closures. And a final note, doctors training right now are getting an unpleasant introduction to medicine without the supervision and mentorship that they should have. It's really not a great environment for the next generation that we're all counting on, Nafisa.
All right. Thank you, Penny.
You bet.